now we're going to start the lymphatics to go down the rest of the body. We've done the pelvic area, and we're going to come down behind the knee. So, I'm going to move her blanket. Well, actually, how about we cover, we'll cover her upper body. Keep her warm, okay? So, the one thing from the pelvic area, okay, is we still want to come up a little bit. So, because of the fact that, in this case, from up here, we're just kind of coming in. So, it's the same thing. It's bringing all that fluid that's from around your sciatic nerve, your hips, and bring all that fluid in. Okay, from that point, we're going to go down, okay? So we're going to come down the thighs to the knee. So we're going to start from the top of the thigh, and we're coming down to the knee. And it's just kind of a straight line. You go your 4 fingers.
How would I do that if I'm working on myself?
So if you're on yourself, you're pushing down. 4, just like you're pushing down.
So would I lift the leg to go down the leg if I'm in lying, or would I sit up?
Lying down or sitting. So if you're lying down, you're pushing down. If you're sitting, you're still pushing down to the knee. You're still the same motion, whether you're sitting or lying down. It's still moving 4 fingers.
So it doesn't matter if I can't reach that far.
Nope.
I could just lay here and
just
do this.
as far as you can go. Because I'm actually going to have you pick it back up, okay? So it's a matter of, so in this case, I'm coming down, you're pushing down, but I'm pulling down. But it's the same motion, whether the practitioner or you are doing it. So as a self person, you're pushing down. Okay, then, I'll be honest with you, I'm going to take from the side of the pelvic, and so you on the side of the pelvic as a self would be side, right? And if you were sitting... Now, if you're laying down, I do suggest to kind of bring up your knees a little bit at this point, but it doesn't have to be. But we're going side up. So it's side. 2, and 3, and 4, and 5, and 6. Good job. I'm going to lay those back down. Now, for the self, a chair would be better behind the knees for you sitting. For laying, it's easier for her to be in a laying position, because we basically want to go, again, the drainage for this one is behind the knee, okay? So it's very much like you'll feel it. If you feel the hole kind of behind your knee here. So sitting is ultimately for a self, but the movement is the same, okay? Because, when you were laying, you were kind of pushing to here. So we're just going to take the wrist and come behind the knee. It's almost like an L from the top of the leg around the knee. And so if you're sitting, it's easier to do this yourself from a sitting position.
Mm-hmm.
3, 4.
And again, it's very much following the line of the joint.
Yes.
I think for anyone, if you have trouble like me processing videos, trust yourself. It's going along the line of the femur, arriving at the joint, and then just circling right down around the patella, and then circling underneath the knee. It's a very natural.
It makes
movement.
sense. Like you'll feel, and honestly, what's funny is the fluid actually will follow your fingers. It's almost like a magnet. I've learned the fluid. It's almost like it wants to drain, and so it will follow your fingers, which is pretty cool because of the way our bodies are designed.
Speaking of design, one of the other inflammatory issues that we have is that lovely mast cell activation, which is under a ton of research right now, so no clinical presumptions here, but it does seem to be that a lot of us, most of us, things are just more fragile and more unstable, and so even at the cellular level, to varying degrees, this is in all of us. We all have more inflammation than normal.
Yes.
In the immune system. So how does the lymph work help with mast cell stuff? Because I know you do not have, and chatting a little bit, you don't have any traditional medication for yourself for mast cell control, and mostly do lymphatics. So what's been your experience with, as you're working on my knees?
So I'm doing the knees now as she's talking because I was going to say, so knees get trapped inflammation more than any other joint outside of your shoulder on your body. Can you guess why? Sitting. You have no choice. You're stuck in a position. Most of the time sitting. In our cases, it could be a million reasons for the inflammation that we have building, but 90% of a normal population is sitting. Because it traps. Whether you're driving a car, your legs are sitting. You're sitting at a desk, your legs are done. It traps behind the knees.
Mm-hmm.
Now, in my case, I learned early. I was very blessed about lymphatics before I was on medication for years, couple years, over my neurocardiogenic issue, which was where my disconnect came from the body to the brain. And I learned that I was pooling liquid around my heart, around my lymph nodes of my chest area, and in my pelvic area. And doing lymphatics, and then early when I learned about it, truly moved the fluid in a way so that it could vacate my body. In my case, or in anyone's case, if your body is flowing appropriately, what you put in it can actually get where it needs to go to fight inflammation. Now, certain medications, as you've learned, and for those of you on some of the medications you're on, because I was on severe antibiotics, as well as gabapentin, Neurontin, and a lot of nerve medications, it pools in areas of your body that it can't go away. By doing appropriate lymphatics and fluid, I was able to get that medication to move in my body, and things started moving, and my body actually started moving. Instead of being in a cramped position 24/7, I finally was able to move by simply getting the fluid to move in your body. Your lymphatic system, think about this. Every protein, every water, every medication that you put in your body goes into your fascia, through the lymphatic system, which feeds the ligaments, feeds the tendons, and feeds your muscles. Mm-hmm. If you are giving it medication to cramp, it's going to lock up until it's released. By doing appropriate lymphatic will allow that muscle to release, and whether it's medication that needs to get, or protein, or fuel that from the water, whatever it is that you're giving it needs to get, is the only way that it can get.
So with hydration, it not only helps any medications we're on to work better, to really reach the body, which keeps doses lower and more effective, but there's even the potential to have it do its job and not need them as much anymore.
Exactly. Mm-hmm. And in my case, that's what I've learned, is that I found that the proper hydration of fluid was better than the medication I was on. But again, water is important. The type in my case, I've learned that you can't, purified water is nothing. People are like, oh, purified water. Purified water has nothing in it, which is good because it goes right in and out. So if you want something to not touch anything to go in and out, purified water is great. Spring water, well water, or alkaline or barium, or water that's been infused with herbs, I hate to say that, but I'm plugging my own self for a moment here, is what your body needs, because that allows it to properly hydrate. You want something like, spring water has iron, and it has alkaline and barium, and those things that are in the soil that are good for you, and those things are what help properly actually hydrate the muscles, the ligaments, the tendons. Ooh, she's got more fluid under this knee than she did on the other. I'm putting a little more time. Again, I'm doing the same motion to go around her knee, but there's a little more fluid here that's trapped. But proper hydration allows the body to be fueled properly by that water. Mm-hmm.
And you were mentioning about sitting, and that's what I'm really excited about, pairing stuff like this with our other movement processes, because when you're sitting, it's frozen and we're not getting it. Think about the impact when you walk. When you press your foot into the ground, you're activating muscles which push the flow. You're increasing blood flow, you're increasing lymph flow. When we walk, when we engage the ground and press into it, that's what promotes a lot of the healthy flow for maintenance, so that you're not just on a table all the time or having to do, this to survive. We can get to a place where hydration and good walking and motion can be our lifestyle and our movement.
I like saying this: every step is purposeful.
Mm-hmm.
Every step you take, every time you pick up your foot, you have to think, I am picking up this foot, I am stepping purposely to the next. And I know a lot of times you're like, I don't have time to think about the steps I'm taking. Eventually, the amazing thing about your brain and your body is the more you go, I am picking up my foot and I'm stepping on the ground in a certain way.
Mm-hmm.
Eventually, you do it enough, your brain just automatically tells your body what to do, and you don't have to think about it anymore. This is the critical thing. So for every step you take, remember that it is purposeful. You pick up the heel, put the heel down first, then your toe, then you pick it up, you lift the knee. There are so many things with every step you take that allows the fluid to flow, allows the body to release
Mm-hmm.
and take in what it's supposed to by a simple movement of taking a step.
And I'm already feeling so much better. It is amazing. We were chatting on our little break, how when you get our bodies, for how many difficulties they have, it is amazing how fast they respond positively to the right treatment. And that's those breakthrough moments for people. It's like, it worked because we followed its design.
Exactly.
We did what we followed its shape, its pattern, and its purpose, and it works.
So I'm going down the legs, as you can see, and I've been going down the legs in the same motion, down the calf, down into the ankle. The ankle's the last lymph node. It's a teeny tiny hole. So
Do you want to go up? I could bend my knee. Do you want to show them where you're working up close?
So I'm literally that little hole right there. And it's on both sides of your ankle, right underneath that ankle, right behind that ankle bone. It's little circles. And that's the last drainage that we're going. And you may not, at this point, most people say, I don't ever feel anything because it's so tiny. But if it's been blocked a while, for people with lymphedema or where it's blocked up in the legs
Mm-hmm.
and where that blood is pooling, your ankles are probably the most, for my diabetic clients, this is the number one hole to work on.
Mm-hmm.
Besides behind the knee. Now, behind the knee is also very important.
It feels very significant.
And so do both legs. You always have to make sure to do both legs. And again, like we talked about, you can be in a chair, you can be laying in the bed. And if you're self, then you're going to probably, my suggestion is if you're doing self, instead of leaning over, is bringing the ankle up. So like if we did this and bringing the ankle up and then bringing down like this, for like what she's doing right now. That's easier by bringing the foot to you than trying to come down to your foot. Because again, your head, where the placement of your head and brain is, will affect the rest of you. And anytime you're laying on your back, as you all know, that possible dizzy or neurological issue can come into play when you come up or lean over. So when you're on your back or when you're sitting in a chair, you're bringing the foot to you and working on the ankle that way.
And we could do a few different variations. Like I could do this
Yep.
if I'm struggling, or possibly put the leg on something else if I'm on the floor, yeah?
Yep.
For extra support.
Yes.
How did I do?
Fantastic. Fantastic. So from a lymphatic perspective, this is an entire lymphatic from the body. The critical thing about what's very important is once you complete moving the fluid from the head all the way down to the ankles, is ensuring that you do get proper hydration. And I will say that is, again, important. I know I've kind of said it already, but the water that you put in or what you're putting into your body is just as important, because you just moved all this fluid. There are toxins now that have been freed. The thing about the lymphatic system, if you think about it, if it's your fight system, right? It's what goes in, it's what goes to an inflammation point, it's what goes to a cut, it's what goes to a bruise, it's what goes to a headache. If you get a headache, your lymphatic system goes, "What? Let's go fight that headache." So all of them rush, right? Just like a rush of, like your head, when you get like a head rush, all your lymphatic system says, "Woo, let's go fight." If you don't have the proper nutrients to go and fight, that's where in our world we have problems, because it doesn't have the fight. What is in your lymphatic system? Fluid, the right water, and the right nutrients in your body are what helps to give you the fight. So your medicines to work better, what you're currently taking, the foods that you're eating right now will continue to help you fight.